may I now request our guest of honor, Dr. Franklin, CEO, Helpage India, Mr. Rohit Prasad, Head, Cipla Foundation, Mr. Anurag Mishra, to proceed for the ceremonial lighting of the lamp.
The official inauguration of our new palliative care unit in the OPD blocks. This unit stands as a shining example of a successful public-private partnership, or we can say the corporate, an NGO, national NGO, and the health department of Chile. It brings together the shared vision of Cipla Foundation, Helpage India, and the Health Department of Leh.
Made today possible, beginning with from Cipla, Dr. Anurag Mishra and Prakash Fernandez, Dr. Tashi Tinlis and Dr. Rinchan Chosdan, and also to Helpage for helping Cipla get over the formalities and being able to go forward with this project. For many of you who don't know, my grandfather started Cipla, and that commitment that we have in the family to healthcare has been there since close to 90 years. For those of you who don't know, Cipla is actually celebrating 90 years this year. So that commitment to healthcare has been since then. And actually, when I spoke to Anurag Mishra about coming to Ladakh and doing something in Ladakh, I said palliative care. And nobody really questioned that. And nobody said, Manisha, why palliative care? Why not working with the environment or working with clean water or working with anything else? I think you never really questioned that. And I want to tell you today why I said palliative care. In 2005, I lost a very dear friend in Leh to cancer. By the time he was diagnosed, he already had stage 4 stomach cancer. And he was given barely 6 months to live. I saw how both he and his family struggled, and they had to cope not only with the emotional pain, but also they had to make him comfortable and with the pain that he suffered. He actually spent his last days of his life here in SNM hospital. And I think for me, setting up this palliative care center here is in many ways a dedication to him and in honor of his memory. He was from Fikse. His name was Palbar Gopa. So I think end-of-life experience is not something we all think of or we consider important. But as much as living is important, I think end-of-life experience is equally important. And palliative care for Cipla has been around for almost 30 years. And we have that confidence. We know how to take things forward. And I really hope that this center will make, a kind of a difference to people's lives here. And I hope this project is only the beginning of Cipla Foundation's involvement in Ladakh. Oops. I hope that we will continue to do more work in the future, not only in palliative care, but in many other areas as well. So thank you very much to everybody.
Today, I congratulate you all for this historic day of setting up of a palliative care services center at SNM Hospital. In the high mountains of Ladakh, distance is not just in kilometers. It is in pain, in loneliness, and in silence. For years in SNM Hospital and in the villages of Ladakh, we saw the same story. A patient diagnosed with the cancer, kidney failure, or any other chronic illnesses, the treatment would continue. But the pain, the fear, the question at 2 a.m., what next? What will happen to us? What will happen to my children? Had no answer. The caregivers suffered too. A daughter who left her job, a son who became a full-time nurse, a wife who had no one to talk to. Medicine was treating the disease, but who was treating the person? It began with a virtual meeting with Dr. Monisha Ahmed, Cipla Foundation members in the month of March, April last year. The question was very simple and heavy. How do we make sure that in Ladakh no patient suffers in pain and no one dies alone? That day we decided palliative care will not mean giving up. Palliative care means starting care from the day of diagnosis, working with the patient throughout the treatment, through the bad days, the good days, till the very end, and even after, during the bereavement period. A few months later, the team from the Cipla Foundation visited Leh, and then we met with the Commissioner Secretary, Health and Medical Education, UT of Ladakh. She has a very vast experience in clinical as well as in administrative. Padma Sedup, he has done master in social work. He will work as a coordinator. Sona Mangmo, again masters in social work. She will work as a counselor or the social worker. And Dr. Padma Lanzis, masters in physiotherapy. She will work as a physiotherapist. And to strengthen this team, we already have our palliative care nurses within the SNM hospital. So congratulations once again.
It's a really wonderful moment for the people of Ladakh, because we are going to, courtesy Cipla and HelpAge, we are going to see palliative treatment here. I also come from another hill state in Northeast, where I don't think we have even started palliative care, even though the incidence of cancer and stroke and even kidney failures, dialysis, these are very high. So I'm really happy that we are starting here. And a special thanks to Cipla and HelpAge. I can commit on behalf of the Chief Secretary also, all possible support for this palliative care unit. Enough has been said about palliative care and how important it is and the gap which it will fill. So since it's highly technical, I will not add much beyond that, and I don't know how much to add also. Just one suggestion. We have an alternate system of medicine here called AMCHI system. So even we have a unit in this hospital also. They are also into palliative care. I think they are doing quite well for stroke and other terminal illnesses also. So if you can take some inputs or see some collaboration with our AMCHI system, it would be good. We even have a National Institute of Sovarikpa, which is an autonomous institute under this one, Ministry of Ayush. They get a funding of 50 crores a year. It's a very big institute here. So, and in the salary component, they spend only around 8-9 crores. So the rest, they do this work. So there is a very good chance of a collaboration with the system also. So I'll invite you to that also. Then I'd also like to congratulate the health team here headed by Dr. Thinley, Dr. Rinchen, and the medical superintendent, deputy medical superintendent, and all the staff. We are going ahead, and let us all work together for a better and healthier Ladakh. Thank you.
Palliative care services inauguration
Because you got palliative care is from the Chino, palliative Napa Mama Picket Catholic, Kampa, Tatur Goshes to Sugarlata, deep than can you do, Kachi cancer second you do, Yarinas, Rosiniz, low Chenmo second, Teulata, something to talk with Italian. Natai, Teula, Natai, Kampena, Gazu Kirchen, Gazueltin, Teunata, Tesos patient, Nata, hospital, Kosikazuki, Illustrosena, Campimula Gazuil have been Tesco line. The palliative care is Natai, hospital, job bunch admits on sitting na pound bunching Galichan Valley. In a mat hospital, Machan and daytime pick a young Mampik buses on Valley. Tartok Mampik churches, Marcha churches, Tesco line. Palliative care could bring a Cipla Foundation, HelpAge India company is in a way. Who is not a rock Nampo, Ikata, what Chunji chose and the palliative care could bring Shurichus in custody.
Palliative care is hospital not doing youth and all.
Oh, Indian, Dulan youth and care. 다 드링 지조선 없으나 드링 갔다 펠리틱 케어 이렇게 डॉक्टर चिक थोपसेन होले 드링 갔다 नर्स थोपसेन होले तेने ये बुक कोऑर्डिनेटर जो गता स्टाफ जी थोपसेन होले 펠리틱 केयर फोन तेना लास पचो चनो नाम संभाले करू गता नपा इजुक्षिक योडो गावा गता खंपा केयर प्रोसेस दो या हॉस्पिटल नंकु ते सब 펠리틱 केयर है सब ची इलाज चुचे ते समाधान चुचे नकस
이 charges po kok shiyo parang charges na
जैसे चामे कर गता हॉस्पिटल एसएनएम हॉस्पिटल ची संग फ्री नोले 펠리틱 केयर ang फ्री नो खंपास को ना खंपा डॉक्टर यूज के ना फीस चंग फो मन नोले कस
Yes, sir, sure.
Just facilitate. They do most of the work.
No, but I will tell you one of very few hospitals who has morphine. Seriously, and first time when I visited, I was surprised. You will not believe Bombay hospital don't have morphine.
We have a license for
You have license, you are RMI, which is exceptional.
just 3-4 days.
Which is exceptional. This is your thought.
Lot of cancer cases are
Correct.
You wanted to have that, you applied for it.
Because we have to borrow morphine from Jay's hospital.
Army hospital, there's Army
They don't
hospital,
have,
Army hospital.
but still they used to have, so we used to borrow. Now since we have the license to.
So this is exceptional, I will tell you.
It's your leadership and you thought about it.
So this will be IPD and OPD both.